Opioid epidemic, the causes and solutions to America's biggest threat. The issue at hand here is the abuse of prescription drugs and opioids in Alaska. In 2017, there were 47,000 deaths in America related to opioid overdoses. That's 130 deaths per day. In Alaska alone, there were 102 deaths from opioids. Over the past 6 years, 6 million prescription pain pills were supplied in Alaska's capital of Juneau. That equates to 27 pills per person per year. In that same time period, 138 million pills were prescribed throughout the whole state. This stems from doctors and medical professionals overprescribing, starting in the 1990s when they began to prescribe more painkillers to non-cancer related illnesses. Subsequent issues from this epidemic include an increase in crime, higher prevalence of HIV/AIDS and hepatitis C, and neonatal withdrawal syndrome, which is 8 cases per 1,000. This chart is from the last 10 years. It shows how the opioid overdose deaths in Alaska has increased. 2007 to 2008 had the highest jump, and 2017 had the highest amount of overdose deaths. Other health issues in Alaska include wildfire smoke causing poor air quality, vaping illnesses and injuries, cancer which affects 176 per 100,000 people, alcohol and tobacco use, high rates of suicide in those 25 years and older, which is 25 per 100,000 people. Obesity affected almost 30% in 2019, and depression among those of Native American and Alaskan Native backgrounds. Another increasing problem is that only 65% of children receive vaccines. This can have subsequent problems such as measles, mumps, and rubella. One of the biggest causes of this epidemic, as mentioned prior, is the overprescribing of narcotics. This flowchart can better explain the path that this often leads to. Those who are prescribed drugs such as Percocet, Vicodin, and Oxycontin become addicted very fast. This leads to buying the pills on the street when the doctor will no longer prescribe them drugs. This then becomes too expensive, so the addict looks for something cheaper such as meth or crack. When these drugs no longer take the pain away or they build up a tolerance, they turn to even stronger drugs such as heroin or fentanyl. On top of the cycle of addiction, more causes can be attributed to the opioid epidemic. Fentanyl is legal in small doses and lethal in high doses. This drug is extremely powerful and addicting. Many times heroin is laced with fentanyl, and many addicts need more and more of it, which can lead to overdosing. When someone is prescribed prescription painkillers and opioids, it is because they are injured, whether from jobs or from falls or accidents. Many of these happen at no fault of the person, and the cycle of addiction starts with just one prescription drug. Alaska also borders with Canada, which is known as a transfer point. Drugs can be smuggled and can be found easier near borders. From 1990 to 2010, the prescription of opioids doubled, and doctors were overprescribing because of subjective reports of the patient's pain. The doctor would trust the patient's report of chronic pain, which leads to the overprescribing of painkillers and opioids. While there are health problems caused by the opioid epidemic, there are economic burdens as well. This is caused by the use of emergency services such as ambulance and emergency rooms, Narcan administration, which is an opioid antagonist, the treatment of subsequent diseases, the use of legal services such as police, courts, lost property, and maintaining more inmates in facilities, and the loss of jobs and work. As reported by the Council of Economic Advisors in 2015, the opioid epidemic has cost the United States $504 billion. Although addiction can affect anyone and everyone, there are some populations that are more at risk. Teenagers and adolescents, especially those who identify as lesbian, gay, bi, transsexual, and other identities, those who suffer from chronic pain, those who work in high-risk workplaces such as construction and concrete, and veterans are at risk for opioid abuse since they are in physical and mental pain and need alleviation. There are short-term and long-term interventions that can be implemented, and some have been in place in the state of Alaska as well as the whole country. Some short-term plans include Narcan and making it readily available as an emergency service within the whole state. Many states have received funding from the U.S. Department of Health and Human Services and other agencies. Alaska received $10 million from the United States Health and Human Services, $6 million towards medication-assisted treatment, and $4 million towards extending the inclusion of substance use and mental health problems in treatment centers. Syringe service programs are community-based interventions that include the disposal of sterile syringes and also provide vaccinations, testing, and treatment of infectious diseases. Some long-term interventions include rehab and treatment, and pain management for those with chronic pain and are seeking painkillers and opioids. Police Assisted Addiction and Recovery Initiative is a nonprofit organization that has been used in 31 states, including the U.S. Department of Veteran Affairs Police. It is focused on aiding those who are addicted and want help. The main point of this is to assist those in need and send them to treatment instead of jail. The addict does not face any jail time. This reduces the stigma of addiction and reframes addiction as a disease and not a crime. Prescription drop-off is an anonymous way of safely disposing of unused drugs, and the drop box can be found at pharmacies and police stations. One of the most important interventions that everyone can contribute to is reducing the stigma of addiction. We need to talk about it more in private and home settings. Addictions are undertreated and underdiagnosed because of the stigma around it. Those who have been through it should speak up more and tell their stories. If others see it is possible to stay sober and get treatment, the better chance they will seek help. Increasing the access to evidence-based treatments means increasing access to medications like Narcan that can treat opioid abuse. For health providers, there needs to be more referrals to pain clinics, rehabs, therapists, and more follow-up appointments, and less prescribing of pain medications. For stakeholders in the community, you can help. Every year, there is a conference called the Prescription Drug Abuse and Heroin Summit. The summit is specifically for you and how you can help your community combat this epidemic. We all know that no two communities are the same, so this will give you the tools to fight the disease of addiction. We also need more use of health education centers so people can go seek the education they need without feeling as if they will be judged or charged with any crimes. I do believe that if more states implement the police-assisted recovery initiative, that there will be a decrease in drug-related crime and an increase in recovery. There's also funding available from the CDC and U.S. Health and Human Services if states need extra support. And lastly, we need to have more policies in place to assist addicts in receiving help, such as policies to cover pain clinics under insurance, as well as covering medication-assisted treatment, which combines medication, counseling, and behavioral therapy. With education, prevention, interventions, and understanding, we can all work together to reduce the stigma of addiction and increase the rates of recovery.